So the first thing we're going to start with is our pre-procedural steps. And the first step is going to be to check the nursing care plan or the order. Gather our supplies and equipment, which I have everything gathered up right in front of me. Wash our hands using standard precautions. Introduce myself to the patient and identify the patient using two identifiers, the name and the date of birth. Provide privacy by closing the door or the curtain. Explain the procedure to the patient. And raise the bed to the appropriate height. If we were using a bed, we would do that. So we're going to start off with a pain assessment. So I'm going to ask some questions and assess the pain. Where is your pain located?
It's in my right lower calf.
Your right lower calf? Okay, when did the pain start and does anything make it better or worse?
It started after my 5-mile run this morning.
Okay,
And it's only painful when I run.
all right. How would you describe the pain?
It's like an achy cramp.
An achy cramp? Does that pain radiate anywhere?
No, just right there on that lower calf.
Okay. Using a standardized pain scale of 0 to 10, with 10 being the worst pain, how would you rate your pain?
It's like a 4. When I did it, it's a 4 when I'm running. When I'm just sitting here, it's a 0.
Okay. And at what time did the pain first start?
This morning when I was running, so 9 o'clock.
At 9 o'clock this morning?
Mm-hmm.
Okay. How often does it occur?
It just occurred when I was running.
Okay.
So, just at that time.
Okay. How long does the pain last?
It just lasts for a few seconds and then it goes away.
Okay. So now that we've done a basic pain assessment, I'm going to do some vitals on you. So the first thing that I'll do is I'll check your temperature. So I'm just going to have you put this thermometer in the back corner under your tongue, which is the posterior sublingual pocket. Okay. Temperature is 98.6, which is great because your temperature should be 96.4 to 99.1. The next thing we're going to do is check your oxygen level. So I'm going to put this on your finger. Your oxygen is 97, which is great because your oxygen should be 97 to 100%, but anything over 95% is acceptable. Next thing I'm going to do is I'm going to palpate your right radial pulse, and I'm just going to check your pulse rate. Your pulse rate should be 50 to 95 beats per minute. I would count for 30 seconds. If it's normal, I'm going to multiply that by 2. And if it's irregular, I'm going to count for a full 60 seconds. At this point, I'm just going to go one more time, and I'm going to do the same thing. This is for respirations. I'm just going to count 30 seconds and multiply it by 2 to get your respiration rate while I'm watching your breathing. Your normal respiration rate should be 10 to 20 breaths per minute. So it's very normal. Your respiration rate is 18. That's perfect. If it was irregular, I would keep counting for a full minute, full 60 seconds. The next thing that I want to do is check out your blood pressure. So I'm going to have you just come a little bit closer to the table and elevate your left arm up on the table with your palm facing upwards. Make sure your feet are flat and you're in a comfortable, relaxed position. First thing I'm going to do, just kind of roll your sleeve up a little bit and make sure the cuff fits your arm. Fits perfectly. So I'm going to align this arrow with your brachial artery. Just going to palpate here. Okay, so I can feel your brachial artery. You do have a pulse, which is great. I'm going to put on your blood pressure cuff. It is approximately 1 inch above the antecubital site. And I'm just gonna pump this up. It shouldn't hurt you. It's just gonna get a little tight. All right, I have 120/80, which is perfect because a normal blood pressure is 120/80. Okay, so the next thing we're gonna do is, since you're having pain in your right lower calf, I'm going to just have you bring your leg up here, your right leg. I'm gonna evaluate the leg and feel for pain. And then, now that it's elevated, I'm gonna apply a cool compress, and I will be back in about 30 minutes to reevaluate you for your pain and see how you're doing. All right. So at this point, we go through the post-procedural steps, which are, if she was on a bed, I would return the bed to the appropriate position, raise the 2 bedside rails up, make sure that there's a call light at reach for her, assess the patient and ask if she needs anything else, and let her know when I'm gonna be back, dispose of my PPE, clean any contaminated equipment that was in contact with the patient, wash my hands, and document everything that happened, the time, date, assessment, and the patient's reaction to the procedure.